This is Dr. Kavita Warrior. So today we're going to do something really different. Okay. Now we're going to learn how to read the MRI of a lumbar spine. Now what is an MRI? MRI is a test where strong radioactive waves and radiation are passed to the body so that we can read we have an image, a clear image about the brain, the spinal cord, whether anything happened to our disc or anything happened to our brain, etc. Okay. Now, us as Ayurvedic doctors, we have this kind of we straight away go to the report and we see whether what happened, like L4, L5, L1, L2 and everything. So we see there is something written. But isn't it much better and much great if you're able to read an MRI? Yes, so let's dig in. Now before that, press the bell button, like and subscribe my channel to get even more interesting videos, okay? Now, I have put here a very normal MRI of a lumbar spine. Okay. Now there are two views of a lumbar spine. The first is a side view, which is sagittal view, which we say in medical terms. Another one is bottom up view, from where we see from the bottom to the lower part. Okay, that is an axial view. Now you can see here the difference of one which is a side view and one which is a top view. Now this is what we see in the MRI. Whenever you get an MRI, you can see there is a difference. Okay, so you have to always kind of keep reading MRI of a normal one and to a whether any disc bulge or herniation and something. Okay, so here you can see different types of disc. Okay, that is where we say L1, L2, L3, L4, L5. Okay. And in between you can see the vertebral bodies, and on the right side you can see a little bit of white flowing, a river flowing, which is the spinal fluid. Nearby there is a gray, did you see that? A gray thing just when it comes to the lower part, it just disappears, right? That is the spinal nerves. Okay, now the bottom part from that, actually that's a spinal cord, when a spinal canal, which we say. When it comes down to the lower part, it becomes like spinal nerves. Okay, that is where our nerves are getting connected to our spinal cord. Okay, now behind that is the bones. Okay, I'll be posting another video where I can show you with an actual demo piece. Okay, right now just get along with this. So this is a very normal basic MRI of a lumbar spine, and the other part is the axial view, where you can see that the white color and the nerves and how the disc is kept and everything. Axial view is a bit confusing sometimes because we are having a little bit confusion, like, well, what happened to the disc, or whether there's enough fluid, and about how the bones are kept. Okay, now here we will get an idea whether the disc is bulged or whether the disc is herniated or whether it's a slip disc, etc. Okay, now another thing, I have posted another image here, which is a clear-cut image of how a disc bulge looks like, how a disc herniation looks like. Now the difference is basically disc bulge is where you can see the disc is bulged a little bit towards, but not putting too much pressure, but a little bit towards the spinal cord. Disc herniation is a little bit more severe when it comes out and giving much pressure to the spinal cord, and that is when we say, oh my god, I have severe pain in my lower back. I don't know why, but when I try to stand, or when I lift too much weight, that is when I'm having a problem. That is where you're having too much pain because you're not able to stand longer or sit longer, or when you ride a vehicle or something, suddenly when there is a pit or there's a hump or something, that kind of pain will come. Okay, now this is the main difference, is about the severity and the picture, which clearly shows you how the disc bulge would be and how a disc herniation would be. Now how does it look in an MRI? Here you go. In the MRI, it looks like this. Okay, you can see that the black thing, if it's a disc bulge, it's a little bit towards it pushes a little pressure, but a disc herniation, it pushes more. It pushes like too much spinal cord, which gives the pressure too much, and the fluid is not much there. You can see that very clearly. You can see that. Okay, so this is the main difference. This is the main thing when you see a disc bulge and disc herniation. Okay, now sometimes you will get confused with this and disc degeneration, which is a little bit different. Okay, I have posted another picture here which shows the this is an MRI of a lumbar spine, a patient having disc degeneration. We can see about how the disc looks like. Does it bulge? No. Is there an herniation? No. Okay. So for more videos, try and comment under the comment box so I can post another video. This is just a basic thing about how to read an MRI, how the lumbar spine would look like. My next video coming up would be a little bit more details about these kind of MRI, CT scan and X-ray.